Welcome to Don't Be Rash, the pediatric dermatology show, the owner's manual for your kid's skin, and the official podcast of the Society for Pediatric Dermatology. I'm your host, Dr. K, board certified pediatric dermatologist and father of two boys myself. On today's episode, we're going to introduce the audience to the Sturge-Weber Foundation and the very important work it performs. To get started, you have to first understand what a portwine birthmark is. This is a capillary malformation, usually red in color, can be anywhere on the body. And very importantly, we know now through recent science that this is almost always caused by a very specific somatic mutation. Somatic refers to the fact that this is not something that's passed necessarily from one family member to the next generation. It sort of exists in one patient and stays there. Now, port wine capillary malformations can be present in isolation, can show up anywhere on the body, or they can be sort of part of a larger complex of conditions. Specifically, the one that we're talking about today is called Sturge-Weber syndrome. That's a combination of usually a forehead port wine birthmark in combination with eye involvement. Specifically, we're worried about something called glaucoma, which can lead to vision loss. And sometimes even brain involvement that can range from anywhere between from headaches all the way up to very, very dangerous, sometimes deadly seizures. Now, it turns out May is Awareness Month for not only Sturge-Weber syndrome, but also port wine birthmarks in general. And I thought it was a great opportunity to bring the team in from the Sturge-Weber Foundation and get the word out about what it is that they do. To that end, I am very pleased to be joined by Karen Ball, Chief Executive Officer of the Sturge-Weber Foundation, and Julia Terrell, Director of Community Relations for the Sturge-Weber Foundation. Welcome, Ms. Ball. Welcome, Ms. Terrell. Thank you for joining us today.
Thank you for having us, Dr. K. We're looking forward to spreading awareness and learning a few things along the way, I'm sure.
Well, we are very happy to have you. And for me, I'm a history major. I don't know if you guys know that, but before medicine, I was American history major. So I always like to start with how did you get started? And I'd love to hear. I'm sure there's a good story, maybe a personal one, about how the Sturge-Weber Foundation came into existence.
Um, well, my daughter was born October 11th, 1986, and had glaucoma at birth. So when she was a week old, had the first glaucoma surgery, and then a month and 3 months old. And we were headed down the I-25 in Denver, Colorado, to the neurologist's office, and for her scan. And I remember looking down at her thinking, this ain't right. This is not how this is going to go for this child, not knowing what caused this. So that's pretty much how it started. And then we just morphed from there. We, had volunteers come in. We had physicians such as yourself. Dr. Joe Morelli was one of our first board members, a well-known dermatologist, and Bill Weston as well, grandfather of dermatology partner. And so, so that's pretty much how it started. And then originally it was reaching out to other parents via mail and long distance phone calls. And then it, as things progressed, we got a website, and now here we are today, knowing what caused it and chasing after animal and fish models to test different things out. So I'm very proud of what we've done, but in typical Karen Ball fashion, there's many more things that I want to have happen before I push up some daisies.
You and me both, absolutely. Now, for the audience's sake, the Sturge-Weber Foundation is not specifically only for patients with Sturge-Weber syndrome. Is that correct? You can talk a little bit more about the patients.
Yes. Actually, in 1992, we expanded the mission to help those that have Klippel-Trenaunay syndrome too. And then obviously, the port wine aspect, when there's over 1 million people with port wine stains, we've given a lot of research grants to look at the vascular malformations, capillary malformations that are there, and the impact that it has on the eye and the brain. So honestly, to a lesser degree, we're helping those individuals when they come to us, but we know at the heart of this syndrome is the vascular malformation. So we're always looking at ways to do translational research and see how it impacts.
And just to frame the membership that you serve, how do you have a good idea of how many families are now part of the Sturge-Weber Foundation from a patient perspective?
Julia could probably answer that better than I do. I want to say around 6,000 documented is, I believe, what you told me. But Julia, hop on in and tell me.
Yes, Karen's right. It's about 6,000 patients that we've talked to over the years that we've documented. And there's probably a lot more because, we do talk to people in the beginning, and sometimes they tell us who you are, and sometimes they don't with social media and other pieces of the puzzle.
Well, that's a perfect segue. Julie, would you mind explaining how you got involved first with the Sturge Foundation?
Well, it's a funny little story. No, my journey started about 17 years ago, similar to Karen. My daughter was born, and it's funny. I remember thinking it was like a revolving door. That birthmark was right where it shouldn't be. On the forehead, down the one side, there was a line straight down and to the right. And, it came with several doctors. I remember the pediatrician coming in, and I remember each one, just one right after the other. And in doing so, they all had this very frightened look on their face. They looked at us like we didn't know what we were in for. And I remember about 4 hours in, they took her away at just, 7 pounds and 10 ounces to go in a CAT scan machine to see if we had any calcifications.
Yeah.
So very frightening, very scary. And I was in the mortgage field for quite a many years. And one day I got you know, working that way and looked at different pieces. And I called the foundation because everybody kept looking at her at different ways. And I look at everything like a business plan. So I needed someone to look at the whole plan, right?
Right.
And that whole child. And funny thing, the Sturge-Weber Foundation was having a meeting in New Jersey, and she was all of 4 months old. And that's how I met Karen Ball. Um, Being from the West and the South, she came right over, picked up my baby out of my arms, and took her. And I'm not from there, so I was very on edge at first, like, who is this woman and why is she taking my baby?
Wow.
But the thing that stood out in my mind and always has is that she looked at her as a baby, not as a port wine birthmark, not as all the other pieces of her. And so I knew that day that I was home, and I came home that day, and a home I never knew I needed. Um, and eventually, the foundation became my home for employment as well. I called her one day after a layoff and said, "I'm bored. Tell me what to do." And she said, "What?" And I said, I don't know how to sit at home and do nothing. So tell me what to do." And she said, "Do you want to try social media?" And I said, "Sure, why not?" And 12 years later, I'm still sitting next to her, working our way through.
Wow. So both of you have been and continue to be, it sounds like, personally affected by not just a port wine birthmark, but Sturge-Weber syndrome. That's fair.
Indeed.
Certainly, the birthmark is the part that we all see. It's visible to the naked eye. Can you talk a little bit about what it's like for both the patient as well as the families in terms of some of the invisible symptoms that come with Sturge-Weber syndrome? That could be the physical ones, the headaches, just the Sturge-Weber days. I'm just not having a good one right now. All the way up
Right.
to maybe some of the psychosocial components of the condition.
hmm all along, I've been trying to mentor and uplift families and individuals with Sturge-Weber or facial, Port Weinstein, that you can choose every day whether you have a visible difference that we do, if you're going to be a victim or a victor. So that's pretty much how we roll at the foundation. And it's okay if you want to be a victim one day, because life is just too much. People staring at you, and you're tired of it. But that's pretty much how we roll is, and we try to bring in diverse practitioners and specialties to uplift their quality of life and care and support the family exactly where they are at that time in the journey. Because as you and I know, and many of your listeners know as well, that this is a lifetime thing. And however, lucky for these little babies born today, their birthmarks can pretty much totally removed. Whereas back in the day, you weren't doing it until the age of 5 or 6, and that was, a little too late. So,
You
yeah.
actually just mentioned a little bit about the sort of the network of specialists that support the patients. And I was hoping maybe you could talk a little bit about your clinical care network and what that is, first off, what it entails, and where patients or families who are interested in finding out where a clinical care network is, where do they go to get that information?
Mhm. Well, we just added our 27th site around the US. And just so excited that we have individuals and universities that want to come into the network. Some of them are more research focused, some are more clinical, and others have a lovely, lovely blend. We just had Boston Children's had a wonderful meeting with every specialty known to man that was there needed to treat Sturge-Weber. So we were really excited about that. We had a 40-year-old from South Africa. We had brand new little babies, and so we always try to make the journey as easy as possible for these families. You shouldn't have to fly across country now to go get the kind of care that you need. We trained a lot of you, as Dr. K and I were talking about before we started. I first met him at a SID residence retreat eons ago, and that's how we help each other, and that's how we should. Is we see a need and we try to fill it. But Julie, you can tell them a little bit more about the sites if you want, or how the newest one came on.
Sure. The nice part about it is, as Karen said, we have 27 sites. And when we bring on a site, we like them to have all three components of Sturge-Weber. Um, we used to say three, I should say. We now say five, right? We like the transition of care. And it doesn't mean just into adulthood. It could be transition into any part of your life. And then the mental health
Mm.
piece and the behavior side is very critical. And if we can get all five, we typically make you a center if you show us any kind of want to be there because we need you. As Karen said, a lot of these children, they are too fragile to travel, or but yet you want the best care in the best way. And knowing that myself, it's challenging. It's challenging when they're seizing. It's challenging when they're have birthmarks and you want to do a laser treatment when they're only a few weeks old. You've already dealt with the diagnosis, and then let's get them in and get a laser on that skin, and it's hard, it's scary, it's the whole shebang is just tough. And I know a lot of times if we can say that you're one of our centers or clinical networks, it just makes everybody a little bit more at ease that you've heard of it. Because when we've heard phrases, when you go into the doctor's office, the last thing you want to hear from someone like yourself, Dr. K, I read about it once in a book and it was a line long and it is
Oh,
so unnerving. So it's critical. But the nice part about it is because we have 27 networks now, thanks to your hospital system, and we have scientists all over the country and all over the world, we're now able to have every other year a SWIFT, an international research meeting. And I got to tell you, the most exciting part to those meetings as a parent is watching clinicians and scientists argue, fuss, and fight. And I say that because that means they're thinking and they're walking outside of the box. And, I often say it goes neurology first, then dermatology, and then ophthalmology. The neurologists are the loudest and
really?
the biggest fighters.
Huh.
Oh, yes. They're never wrong, they want to be right. And that's good. We want that, right?
Okay, I see that. It's
Yeah.
interesting because in my experience, ophthalmology really has led the way in some innovation clinically. I don't, it's funny that you said that, but I could see the neurologist being the loudest.
Yeah. And then dermatology, we discuss, a lot of times how, when is the best time? When is, what does that mean? Why are those lips getting thicker? All of those
Mm-hmm.
pieces.
Mm-hmm.
And then
Mm-hmm.
ophthalmology, well, ophthalmologists are a little quieter about it, but they have their opinions too.
Yeah.
That's
Yeah, one of the most exciting things for me that's come out of the clinical care networks and the SWIFRN is what we call it, the International Research Network meetings that we have, and the animal model as well. We do periodic meetings with them. The exciting thing for me is that you've got those who have their expertise in dermatology, and they're talking to the ophthalmologist or the
Mhm.
glaucoma specialist, and they see, oh, the blood flow issues, there's some commonality here. And that will spark off a thread of research that maybe none of us singularly had ever thought of before. So for me, that's the most exciting. It kind of drives the direction of where we need to go. Although with that said, and I want your audience to please call us if they have an answer to this question.
Mhm.
We still need to address that overgrowth, that soft tissue overgrowth in the cheeks and the lip. I haven't done that yet. We need to.
Fair, fair, yes. One thing that I think is really unique and stellar about your organization is, yes, you reference, I wasn't going to bring it up, but thank you. We are, I believe, the 27th Clinical Care Network member. But one of the coolest things about that process was never once was my hometown institution, St. Luke's, ever asked to pay money to get that designation. It was done, I think, purely from an objective perspective. Do we have the services that we claim to have? And you validated that, and that's amazing. This is not a marketing gimmick, is the point, right? So
Right.
there's plenty of groups and other emblems that you can purchase by submitting an application stapled to a $5,000 check, and congratulations, you're a center of excellence, or some made up name thing. But
Right.
this really does provide a resource for the patients in the areas, and it's something we're very proud to be a part of, and I appreciate that. What would what would you what's the first thing that a parent has a child born with a port wine birthmark, with or without Sturge-Weber syndrome? What's the first thing that you think that they should do after receiving that diagnosis?
I would say be sure you get the eyes checked because that glaucoma is a sneaky little sucker. And most parents are more concerned, obviously, about getting the birthmark removed. And of course, we send them to the dermatologist as well. But oftentimes, we like to see that the eye is still healthy and viable, and we're not dealing with something that's already run out the gate. And then we also put them in touch with the neurologist, so they can get a baseline scan of where they are or not. And again, we just try to bring in what they need, where they are. And oftentimes, and you as a physician know this even better than we do, it's what's not said that you have a sense of, I need to address this because I think it's a concern for them.
Right.
You can just tell, right?
When do you, as a foundation, want to hear from those families with a new diagnosis? When do you feel it's worthwhile for them to reach out to you and connect with that larger community?
Well, I think Julia and I would both say day one, because oftentimes, especially in today, they just go straight to the internet. And as you and I both know, there's a there's a plethora of things out there that you don't even need to pay attention to. And it just sparks fears and frustrations. Would you say that, Jules?
I would say yes. We should be the first ones you call. And just to know that there's two people sitting at a foundation that's been where they are. And the only thing that I would change what Karen said earlier is breathe. It's
Yeah,
gonna be your new
exhale,
normal,
and breathe.
and it's okay. It's okay to be scared. It's okay to give up the planning. Sturge-Weber has a whole plan of its own, and it's gonna come whether you like it or not. Glaucoma's gonna come when it does. The birthmark is going to grow where it grows. We have no control. So one thing in life you just don't have control, and no one knows what you're feeling until you feel it. And unfortunately, you know, I talk to a lot of families, and a lot of families say the same thing. And you can almost hear them settle right down when you say, I have a 17-year-old and she's doing fine today. And then they say, how did you do it?
Hmm.
And it's the same thing you do with anything else. You put one foot in front of the other, you take, you know, and 99% of the folks that we talk to, because of the knowledge that Karen creating this foundation almost 40 years ago gives us the chance to go somewhere. And with that in mind, it makes it a little bit easier. And the other piece of the puzzle, I know it's funny to say, they always say, well, what can I do? What can I do? Keep them safe, love them, forget about the diagnosis for a minute and live. And then when everything else settles down, love each other inside the family too, because it's going to take a village to get through Sturge-Weber. And we're lucky to have doctors like yourself, Dr. K, because you're enthusiastic and you want it to go forward because that's what we need. We need people to believe.
Where might some of these families be traveling to in the upcoming months?
Take it away.
So in the upcoming months, you go to your average doctor's appointment and so forth, but you do come to San Antonio, Texas. This is your greatest opportunity. We are a world of AI and computers, and the one thing you cannot and should not miss is our conference. It's the one time in the world that you meet nothing but people that know what you've been through, know how it feels, know when it just really stinks and when it's really great. We celebrate everything, and we lose a lot of friends over our journey because they sometimes don't want to hear how bad or how good it is, something you might take for granted. So when you come to a Sturge-Weber Foundation conference, the most exciting part is one might say that our kids are a little out of control because for the first time, these kids are allowed to run wild. We're not worried about the seizures. We're not worried about the glaucoma. Every mom, grandma, dad, granddad, everybody there knows Sturge-Weber. And you're not afraid for the first time.
Cool.
This is going to be my fifth one, I think. And when I came to the first one, I was just in awe that I could talk to people and they knew what I was experiencing. The doctors, when they come into the room and play with the kids, it's just an amazing adventure.
As your audience knows too, with many of the other rare skin related disorders, when you come together, that apprehension, that tenseness that I think we inherently carry around when we go out into the public is left at the door. If you have ichthyosis, nobody's looking at your skin because everybody has that. And you can just be yourself and everybody can just talk about, school, work. But yes, we do have a couple things coming up that your particular audience is going to love that we are doing. But that's all I'll say, Julia.
Okay, fair enough. And for this audience, which consists of both patients and their families as well as clinicians, pediatric dermatologists, pediatricians, family medicine doctors, hopefully, it's not, the Sturge-Weber Foundation is not solely focused on supporting patients. You've done a lot and continue to do a lot to support our work. I was hoping maybe you could talk a little bit about the seed grants and fellowships, some of the things that you've offered and how you see that sort of continue.
Yeah. Sure enough, yeah. We have at this time we have two different types of grants. It's a New Horizon grant that we just put into place because we have a patient registry that formally has physician entered information on about 200 cases. Scans, reports, the whole 9 yards to create a 3D picture of that particular patient. In the foundation, as we said, we have about 6,000. So we know a lot of more informal data. So what we've done with that New Horizon grant is we want to get young residents in, med students, that they want to maybe get interested in something that's never been mined before, but we've got the gold mine of patients for them to get in and look at. Then we also have a Catalyst grant that is, it's around 50,000. So it's, it's still, it's for us, it's a significant grant, but many of those Catalyst grants have gone on to get NIH funding that are, larger.
Oh, that's quite significant. And you've been involved. I'm assuming some of the grant money might have gone to support as well, but you are an author on some of the management guidelines that have come out with authors like Kristen Kelly, um,
Mhm.
and Sturge-Weber helped support that.
Yes. Oh, yeah. And actually, Betrelay and Lisa Arkin are really emerging as helping us out with the genetics piece of it in your particular area too.
Amazing.
It's just been really exciting. We just came off a 15-year consortium grant, brain vascular malformation consortium grant, and we're morphing that into a registry that'll be able to be mined around the world. So it's a whole new frontier. It's so exciting. And the best part is, we've spent all these 40 years laying the groundwork and building a network and getting everybody all interested. And I'm going to be able to hand it over to someone
Oof.
in the near future and watch them take it to another level. Yeah.
Okay. You're flipping the switch to autopilot.
Yeah. Hopefully one day.
Well, in order to help the foundation and help that process, where might some of our listeners go if they were looking to make a donation or to learn more about the Sturge-Weber Foundation?
They can go to the website www.sturge-weber.org
Mhm.
or just send us an email, jterrell@sturgeweber.org.
And that's
Mm-hmm.
Sturge-Weber.org.
Dash, yes. Mm-hmm. Mm-hmm. Yep.
Well, listen, thank you so much, Miss Ball, Miss Terrell, for joining us today. What amazing work that you guys are doing and continue to do. It's just a blessing to be able to speak with you here today, and I very much appreciate you taking the time.
Thank you much for having us.
Thank
Appreciate
you.
it.
Awesome. Well, to the audience, thanks for tuning in to this episode of Don't Be Rash, the Pediatric Dermatology Show. I'm your host, Dr. Krakowski. Don't forget to subscribe to our show on your favorite podcast platform and check out don'tberash.org for more information. Of course, a special thank you to our nonprofit sponsor, the Society for Pediatric Dermatology. Thanks for making this episode possible. And of course, if you need to find a pediatric dermatologist in your area, check out pedsderm.net. You can also access all the amazing science-supported, fact-based resources that organization offers its members and the public at large. Until next time, remember, keep calm and don't be rash.